Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of health IT interviews. Today's topic is synthetic data, something that's new to me. I don't know much about, so I think we're going to all learn together. And our guest is Josh Rubel. He's chief commercial officer at MDClone. Welcome, Josh.
Thanks for having me, John. Great to be here.
Yeah, so before we dive into learning about synthetic data, and I mean, we know about data in healthcare, there's lots to talk about there, but tell us a little bit about yourself and MD Clone.
You bet, John. So again, I'm Josh Rubel, and I am the Chief Commercial Officer at MDClone. I come to MDClone with about a 20-year background in healthcare IT, working primarily with provider organizations on deploying, installing, having success with large-scale IT projects, enterprise-level projects spanning from EHR to rev cycle to computer-assisted coding and all in between. I joined MDClone about a little bit more than a year ago as we're beginning our North American growth phase. MDClone is an Israeli company. It's based in Beersheba in Israel, and it's been around since the end of 2016. Recently, MDClone has expanded in North America with a team, a commercial team, a customer success expansion, and then a marketing effort. And we've added 9, going on 10 now, new enterprise clients in North America. So it's been a fun ride since I joined, and I'm excited to talk about both synthetic data, but also the kind of framework and the kind of data landscape associated with healthcare operation, healthcare innovation, and where we fit in, or where we feel like we can fit in the future. And I'm happy to answer any questions you've got, John.
Absolutely. And some of the best innovations come out of Israel. I love Israel and healthcare IT. But, as you look at it, and it sounds like you have a great background in health IT, been doing it a long time, which is great. But, where are we at in really gleaning the value from data in healthcare? As you kind of mentioned, you've been working on data projects forever. We've been capturing it in EHRs and all sorts of different systems. But where are we at in really gleaning the value from that data?
I think it's a great question. And I think aspirationally, there's always going to be more to do.
Yeah.
I think in the last 10, maybe 15 years, going back to the original kind of EHR stimulus checks that went out around meaningful use, I think there's been a desire to get more data digitized and then get more out of that data as it relates to quality improvement, performance improvement, potentially innovations, therapeutics, that sort of thing. I think today we're at the end on the digitization side. I think most healthcare data in the United States and increasingly around the world is digital. Now, is it discrete? Maybe
Sure.
not quite yet.
Uh-huh.
But we've got more, maybe the best way to answer it, John, is we've got more data today that is digital and is mineable, parsable than we had yesterday. And we're going to have way more tomorrow.
Hmm.
Is probably a good way to think about it. And I think the value we get out of it, it depends on the seat you're in. If you look on the life science side, I think you would say that you've got some pretty sophisticated and mature users of data in decision making. I think clinical trials are a great example of data to help define direction forward. In fact, I think clinical trials are kind of built around using data to
Yeah,
tell everyone
that's
it's
fair.
safe and okay to kind of take a certain drug or
Uh-huh.
perform a certain therapeutic. On the kind of ambulatory and or hospital operations side, I think we're just starting to scratch the surface. It's not as mature an environment where data is readily accessible. Data can be used to inform decision making, whether that's care pathway or whether that's kind of staffing model or throughput model. I think we're starting that revolution. We're maybe 2, 3, 4, 5 years into more of a data-driven operator mentality in healthcare. And of course, bell-shaped curve, you see a lot of really amazing things happening in one site and maybe areas for improvement in other sites.
Yeah.
But I think we are starting that journey, and I think there's a ton of value that gets gleaned in those examples like I was just sharing.
I mean, your first point is so fascinating to think about because when you're optimizing a billing system, right? When you're rolling out a PM system or billing system for a healthcare organization, you kind of reach a point where you're finished, right? I mean, sure, you can create new workflows and you can do, you can
Sure.
add AI, you do a few things, but with analytics and with data, that you're never done, right? Like, especially with the complexity that is healthcare, like we could make improvement, we could glean value, but we can never feel satisfied that we're done. That's such a fascinating insight, because there's so much more work to do to understand. I mean, using your clinical trials example, like, shouldn't there be 1,000 different clinical trials happening all the time within these EHRs to understand what's the best treatment plan and what's the best way to care for a patient? We saw that kind of accelerated during COVID. Is that kind of how you guys view it, as trying to leverage this data to add some more clinical rigor to the decision making, or how does MDClone look at it?
Yeah, I really like the way you were describing it, how there ought to be there ought to be more innovation projects going on, more quality improvements happening in all of these different healthcare systems. My experience in the last 20 some odd years, it feels great to say that 20 years,
Yeah.
it works both ways. It's gravitas, but it's also like maybe I'm not the
You're
youngest guy
feeling
in the
old
room
too.
anymore. Yeah. Oh boy. So in my experience working with many of these health systems, the data environment to support what you were just describing, that aspiration you were describing around, hey, shouldn't there be more innovation? Should we be uh, uh, improving care plans daily and not necessarily leveraging a standard that was built 15 years ago? Isn't there real world data that can uh, help
Yeah.
us change behavior? I think that's right on. I think the challenge with that is the data environments don't lend themselves to
Mm.
the lay clinician or service line leader or medical staffer or clinical writer or whoever to engage with their data and come up with those innovations. Actually requires an army of analysts and an army of clinicians that can go kind of understand what got coded and in whatever is in the arcane kind of underbelly of the system in question, whether it's an EHR, an EDW, or an RCM system. I think the key challenge we've had is activating all of the different people inside of a health system so that they can be a part of the innovation cycle. I think is lacking. And candidly, it's one of the problems we try to solve. Synthetics, one of the ways to kind of get to more distributed data availability, and we could talk about that here later. But I think outside of MDClone, and I'm happy to talk about MDClone till the cows come home. The principal challenge in healthcare today, as I see it, is how do we take these amazing people who have chosen roles in medicine and who are at heart often awfully innovative, extremely intelligent people. How do we activate them into this innovation cycle? To me, there's a lot of untapped potential there. And, in many cases, our kind of mission as a company is to help get there.
Yeah. And it's so hard because those people want to be part of those innovative efforts, but how do you fit that into a 15-minute appointment, right? I mean, it's how do you push that to the point of care? It's a tough challenge. But interestingly enough, I actually think, and I'd love to hear your views on this as well. I think we have to have this data and this understanding of data and use of data to be able to move to the value-based care world, the risk-based contracts that, where all of healthcare is going. Is that how you see it as well, as far as reimbursement, that we need to have this data, we need to understand this data and use this data,
Absolutely.
as we move towards it?
Absolutely, John. Thanks for letting me cut you off, even as you ended
Yeah, it's all
that
good.
question. Um, uh, there may be some low-hanging fruit that maybe doesn't require real mastery of data environment and exploration around, maybe, disease protocols that are just very well understood and or quality measures or, kind of cost drivers that are, again, very well understood. But as soon as you get past that low-hanging fruit, my sense is the winners and losers in this space will be the ones who really understand how to engage their data, their experience, and then turn that into behavior change that drives to better care. The value-based care model or risk-based contracts, uh, a lot of different angles to them, of course, and it's probably too simplistic to say, look, it's really trying to codify the quadruple aim.
Hmm.
Um, but let's move aside how simplistic that is. In the case of healthcare, there's a ton. We are in a target-rich environment related to opportunities to reduce cost and improve quality at the same time, right? To get there is, inherently a data challenge on the front end. Who do I focus on first? Where's my maximal opportunity as a health system or as a health plan in a value-based care arrangement to go affect change that's going to maximize margin and or maximize quality? Or in my simple scenario, where are the places in my health system today that if I improve quality significantly, I also improve my bottom line? That's a
Yeah,
data challenge.
that's a good
Yeah.
description. Yeah, and I think I mean, we're moving there, right? Like people are trying to figure this out and how to get more value. I mean, I don't know how many CIOs I talk to that are like, okay, now we have all this data in the HR. Now I'm trying to figure out how to get the real value out of that data. So I think it's an ongoing discussion. But I think what's interesting, as we kind of head more towards synthetic data and the idea of creating data in order to help improve your processes, like, why do we need synthetic data? Don't we have enough data? Right? I mean, you already talked about, we've kind of digitized, which I thought was fascinating that you said we kind of digitize all of the health information. I would add a layer on that that says, but we're going to have more sensors that produce more and better data, which, I think, just as another layer on top, right? But it's like we have all that data. Why do we need synthetic data? Isn't what the data we have enough?
Another great question. So I think the rejoinder to that is who's allowed to access it?
Mm,
And are there limits on access and what you're allowed to do with it and how you're allowed to do with it? So for example, if there's a care pathway that a third party wants to work on associated with a certain subsegment of a diabetic population, and they want to work with a health system, and maybe there's an angle there associated with a medical device or a specific
mhm.
diagnostic. Can the health system share data readily with that third party? Unlikely.
Yeah.
Internally, inside the health system, data use requirements, patient privacy is important,
Mhm.
and health systems guard against the release of private patient information. And there are different layers of security and privacy requirement built into the access protocols in any of these health systems. Um, uh, but what if that gets in the way of actually engaging your data environment to find the next best protocol? What we
Yeah.
find in many health systems around the United States, around the world, is that not only does it get in the way, it can be kind of not a 2 week blocker, not a 4 month blocker, but a 9 month, 12 month, 18 month
Nine
blocker.
year.
And if exactly, and if you're talking about third party, forget about it.
Mhm.
Then you have to start thinking about, oh, let me perhaps we can find ways where I can scrub things out of the data to remove any of the patient identification
Right.
and other items, and then maybe I can ship it off. But you're losing kind of key elements of the data at that point. You're losing features. So what synthetic does in the context of your question is it allows for the same data set, the same story that original data tells, real patient data tells. It allows a health system to very simply generate a fictitious data set that looks a whole lot like that real data, but it doesn't have any one-to-one correlation. The rows of the synthetic data, if rows are patients, the
Right.
rows of the synthetic won't look like the rows of the original, but the story the synthetic output tells will be close enough to the original to do things like train machine learning or evaluate opportunity inside of a population associated with the care pathway like I was describing before. That's what
Mhm.
synthetic opens up. And again, it does it in two places, just for clarity. The first is internal around data access requirements that are internal. But I think even more importantly, it opens a health system to collaborate with the wide world around it so that innovation isn't just locked inside the four walls of a hospital. It can now be opened up to others who may have some really good ideas, whether they're like-minded institutions, other health systems,
Mhm.
or third parties like folks that live in life science or
Sure.
diagnostics or wherever.
Well, and that's a pretty compelling reason. Is the way you create this synthetic data, do you partner with the health system and kind of let the AI go in and learn about their data and then create the synthetic data? Or can the AI just create the synthetic data without any sort of, deep dive into their actual data?
So I love that question. And the answer is I know there's a bit of news today about a company called Nuance.
Uh-huh.
but the answer is nuanced, my friend. Uh, so congrats to the Nuance team, by the way, and to the Microsoft team, if
Yeah,
anyone's
that's going to be
listening.
fun to watch.
Great big news, and exciting to have Microsoft in this space again. Um, so the process of creating synthetic data with MDClone is a unique process, and this is the only way to do synthetic data. So there may be some other models out there, but
Okay.
the way we do it is we create synthetic data sets on demand.
Uh-huh.
It's not really, from our perspective, it's not possible technically to take an entire data set. Hey, all the patient, I live in Atlanta, Georgia. My next door neighbor is St. Joseph's Hospital, which is part of the Piedmont network. Hey,
Uh-huh.
if I'm Piedmont, can I take every single piece of data I have and then create a synthetic data set that mirrors every single piece? Probably not, because I'll get to identifiable data there across the features that I'm
Gotcha.
looking for. On the other hand, and what our platform allows is the exploration work around a specific question. So for instance, show me my patients that are diabetic that have these certain features, and maybe there are 15 things I want to know about them. At that moment, you can pull an original data set full of real patients, or based on either permissions, the only thing I'm allowed to see may be a synthetic data set, or maybe I have a choice and I want to look at original or synthetic. Um, at that moment is when we create the synthetic set. So it's based on the features that I'm requesting for a specific question that I'm asking. Um,
So it's a slice of the data.
Indeed, but you can run that slut. You can do that for any question that you ask, as long as the data that you've pulled wouldn't be identifiable based on a very small number of available
Sure.
data. Then you can create a synthetic data set. But at the permission level in the platform, you could tell, for instance, a user, hey, the only data you have access to is synthetic data. So whatever question you intend to ask, it will be the answer will mirror what it would look like on the original side, but the only data you'll have access to is filled with fictitious patients.
And is the synthetic data, I mean, how do we know that it's similar enough to the real data that, that it's worth, doing the analysis?
Sure.
Is it because the AI engine learned from the original data and then now it's able to use that model? Is that how you approach it?
Yep, there is some learning that goes on, but for every study that we generate, every synthetic data set that we generate, there's a compendium report that shows the organization how the synthetic data compares to the original data. So that's
Hmm.
one thing that comes out. It's an artifact of pressing the run button in the engine. And then, for kind of further kind of proof points, there have been several academic studies, and John, maybe as a follow-up, I'll share with you the academic studies
That'd be
where
great.
the data scientists and informaticists in healthcare have kind of taken a crack at validating that the synthetic data does indeed tell the same story as the original data, and they've done it with a kind of peer-reviewed scientific hat on, so you can see what the real smart people in the space say. I think no matter what, though, based on your question, it does sound a little bit magical, right?
Hmm.
I can create a data set that looks very similar to a real data set, and it will tell the same story. Uh, every healthcare organization that we've contracted with, one of the first things they do is self-validate.
Yeah, I can
And
imagine.
yeah, it makes complete sense, and we support them.
It's about
Um,
trust, right?
yeah, indeed. The same way, even if it's original data, I mean, for the folks listening into this interview, I'm sure many of them have had an experience where they've run an analysis, they've put together a report, let's say it's a quality report. And
Yeah.
if there's something wrong with the report because of data that was pulled, it may be a trust challenge then
Yeah,
with
even
whoever
with the
consumed
real
that
data,
report
right? I
with
mean,
real
there's
data.
humans entering the data for sure. Yeah,
You got
absolutely.
it. So you got to get through that wall with synthetic too, maybe even more so. And anyway, it makes sense to us, and we support our customers when they go through that validation effort to make what may sound magical turn out to be entirely real and entirely useful.
So where will synthetic data play in this? Like, is it really for those third parties where you don't want to do the IRB proposal to get to the real data? You want to protect the patient's health information? Is that the applications you're seeing most, or is there a reason to use synthetic data, not just around privacy?
Well, the value of synthetic in particular is around privacy. If you didn't have the privacy requirements, then the original data would be would
You're
be
not having to
fine.
choose it, right?
Yeah. So I think synthetic speaks to the privacy requirement. Our platform um, has to respond to other challenges in the space associated with what I was saying earlier around this kind of distributed environment. The privacy element isn't what's holding back the line provider who wants to do innovation work around a clinical protocol. That
Right.
may be one thing that's holding her back, but the other two things that are holding her back are her data is organized in maybe a less than efficient way, number one, and number two, the vocabulary required to go do a query and visualize that.
Hmm.
That vocabulary, the capability set, the kind of programming skills, she may not have those things, and she may need to
Right.
rely on an army of people to help her. Uh, the other elements of our platform allow for self-service. We organize data in a certain way so that that provider, in my example, she can very quickly ask the system a question, whether it's synthetic or original, and then within seconds be able to visualize answers to come up with an insight that may be useful. Now, what synthetic does is says, great, Dr. Jones, who I just mentioned, she's able to do that inside your four walls. Now you can take Dr. Jones and amplify her efforts with kind of partnership with a third party that lives around the corner from you, who may have expertise in the space.
Interesting.
Yeah.
Are there any other downsides to synthetic data? I mean, we talked about the privacy just makes sense, right?
Mhm.
Are there any other challenges or even some benefits to synthetic data that, over regular data?
I think the other benefits, there's organizational privacy too, not just patient privacy.
Hmm.
Um, and we're very kind of connected to the healthcare world, and we think about patient privacy kind of more than anything else as it relates to synthetic. But there are other benefits potentially, not just in making your data available to others, but potentially aggregating data with others. So imagine a scenario where you have like-minded institutions that want to do work together, and they wish to aggregate data on demand really quickly. If
Yeah.
they're using a data organization and hierarchy model from MDClone, and they each generate synthetic data sets, uh, we can in seconds combine those and create a much larger data set. So there are kind of collaboration benefits beyond this kind of third-party access, collaboration benefits that kind of span um, to kind of larger data sets, global health initiatives. We have a great example. We have a customer in Tel Aviv, Sheba Medical Center, that's working directly with the Jefferson Health Center, the Jefferson Health Team, excuse me, in
Uh-huh.
Philadelphia. Jefferson staffers are able to access Sheba data in real time and work directly with their colleagues at Sheba to ask questions that they're interested in of the Jefferson population.
Hmm.
It just
Interesting.
enables those sorts of interactions. And so the value isn't necessarily of the data, although the data will support this. The value is, hey, wait a minute, some of these collaboration opportunities that just seemed way too hard yesterday, maybe kind of imminently available to these institutions tomorrow.
Well, I think that's fascinating. I did an interview recently with, I think it was with NVIDIA around an AI project they were doing, and they incorporated the AI learnings across 20 organizations across, multiple countries, et cetera. And the reason they wanted to do that was for generalizable AI, i.e., if I just do it in, South Alabama, I'm only going to get a certain population in
Yep,
South Alabama. Probably not as many Asians, probably not as many, whatever, right? They don't have as many. But when they do it in Alabama and New York and Oxford and Japan, and
sure.
then you can create generalizable AI, which it sounds like synthetic data could help us down that path, which is how do I create an AI that doesn't just work for the population of that one hospital, but works across every hospital? Is that kind of what you're describing?
You've got it, John. I can't wait to talk to your friends at NVIDIA. Yeah, the challenge with what they did, and I'm not privy to any of the details of this project, but I suspect that to get access to all of that data and then to build and tune the AI models and whatever machine learning work that they were performing wasn't an easy task. I suspect it was difficult. I suspect getting through the regulatory red tape to go do that work was no fun, lots of lawyers. I suspect the data management piece was also no fun and took a lot of time and a lot of resources. And our job at the platform level is to make that a whole lot simpler. And if I can,
Yeah.
we were talking before about data projects, 9 months, maybe 9 years, I think was your joke. Um, I want that to be 9 minutes.
Yeah. So it's interesting. The way they avoided it was actually they only shared the AI findings. So the data resided in the organization. So they never aggregated the data. They didn't do any of that. They just did the learning and then they just shared the learnings, not the data. So
Okay.
that's how they avoided it, which the reason they avoided it was exactly what you described, which is if you would have asked any of those organizations to share that data up to a repository so the AI could learn, they'd be like, I can never get approval. In fact, they said as much to me on the interview. They said, I cannot get that approval. The reason I got this approved is because we weren't sharing the data. But I imagine it's very similar for synthetic data. That, oh, I can share synthetic data because it's not any of our personal data.
Yeah, I think that's where we're heading. And I want to be clear. My sense is the privacy regulations in place are useful, and as a human being, as a patient, often as a father of patients, a son of patients, right? I want uh, the best of both worlds. I want there to be privacy requirements
Yeah.
because I don't want my stuff available on the World Wide Web, and I don't want anyone else's for that matter. And I want every bit of aggregated data possible, every bit of data possible to help
Yep.
inform a better healthcare future. I want both those things. I think our view is, in many cases, synthetic can lead the way. You asked a question earlier, John. I just want to cycle back. I know I sound like an evangelist for synthetic data, and I am one. There are uses, excuse me, and scenarios where it doesn't work so well.
Yeah.
Um,
What are
if
some examples of that?
the total population, if you're talking about very, very rare diseases and you can't get past a threshold number so that
Mm.
none of the data is identifiable, um, that's one example. If you don't know what question you want to ask on the front end, and instead you want to let the AI do all the question asking, then the number, in our model, the number of features may be slightly limited. Let's say, we would include up to 150 or 200 some odd features. If you want 10,000 features, you start to get very close to identifiable ranges once the feature set gets too high.
Interesting.
And then, the only other thing I'll mention is in the genomics world, um, if some of the fields are identifiable by nature, meaning DNA level,
Yeah.
you can't create synthetic around that. Um,
Yeah.
and so those are some areas where we haven't quite cracked the nut. Although our smart people are thinking about ways to apply the technology in those places too. And I think we're at the front end here. The use of synthetic data in almost all industries is starting to take off. I think in healthcare, again, we're at the front end, but a whole lot of growth in front of us.
Well, I mean, you're starting down a whole other discussion. We may have to have you back for. I mean, we saw it with Ascension giving all the data to Google and how patients didn't like that, right? And so I think we recently saw a collaboration. I think it was 30 hospitals coming together to say, hey, let's share our data. So everyone's thinking about how to do this because they know there's the value there. But I think many are saying, how do I do it in a way that respects my patient's privacy? And to your point, that respects my organizational privacy from competitors. And eventually, as they all start acquiring up, everyone's becoming everyone's competitor, it seems.
Yes, dead on, John. And look, I think your initial question around data and kind of where it's used and kind of is there already too much? I think whether we like it or not, it will be, if not the currency, it will be the leading indicator of the currency in terms of
Mm.
how we operate as a healthcare system. Um, uh, More so tomorrow than yesterday. I'm positive of that. I don't know what questions people are going to ask 5 years from now, but I'm positive that access to their data environment and getting a fast answer will be a competitive differentiator for them. And
Yeah.
I think you're right. I think lots of strange bedfellows these days, and I don't see that stopping. I think that's only going to get stranger.
Yeah. Josh, this was really insightful. Appreciate you sharing all these insights and perspectives. I'm excited to see where all this data leads. And I think synthetic data is an interesting opportunity that many people don't understand and haven't really thought about. So thanks everyone for watching. And if you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Josh.
You bet, John. Take care.